I'm a geriatric specialist and internist in Western Massachusetts, and I practice some geriatric and internal medicine, but I also serve 400 PCPs in 5 counties and help them with their infrastructure to do population management. We had the problem of 140 PCPs, which now is growing to over 400 by January, on 8 different EHRs that don't talk to each other, working with 10 hospitals that don't talk with any of the EHRs, and a few of the practitioners still on paper charts. And we needed to share information. So we developed a web tool that allows the physicians and the office staff to get the member information. We've opened it up to have the hospitalist and the nursing home rounders use it, and it's made a big difference in their performance in all areas, including the quality metrics and the utilization. We've noticed increased satisfaction by the physicians themselves, the office staff, the members, and the performance in global capitation contracts has gone to best in the state. The physicians needed to start sharing information to provide for all the care needs of their members and to do these new global capitation contracts. They were missing some of the quality data, some of the hospital data. They weren't practicing the way they knew that they could. The payment systems were changing and requiring a lot of exchange of health information and the ability to close those gaps in care, and this integration helped all of that. We were able to get the practitioners to use the information from our information exchange because we made it simple. We integrated it with their daily workflow. We are able to figure out what the practitioner needs, whether it's a nurse practitioner or a primary care physician or hospitalist. We distill that huge body of information into just what they need at the time of the visit. And that made the difference in it being used, or what they were telling us about some of the other systems which were big and cumbersome but weren't being used. For all practitioners, you want the quality information so that you're providing the right kind of care. In addition, we add some decision support, which is helpful. But if you want to do some of these newer contracts and help do population management, you need a whole host of extra information. You need to know what happens in the offices of the specialists that aren't connected with your practice, in the hospital. You need to look at the claims of things that have happened in the past, make sure you're not forgetting anything. So we aggregate the information from the history of claims, from the lab data, from the hospitals, from the different EMRs, and then present it to the practitioner in a way that's easy to get just what they need out of. As a result of implementing this integrated system, and we, unlike some of the other information systems, also integrate some care management suggestions and feeds. As a result of integrating all of that, we've been able to reduce the healthcare expenditure in our senior population by 20% every year for 12 years. We've been able to reduce the commercial health expenditure by about 10%. At the same time, every quality measure has improved. The satisfaction of the members and of the physicians have all improved, and we've helped several individuals live longer and live with their chronic diseases better, with more home support, and we've been able to, for certain of our individuals, provide not only the right kind of care, but more of what they need. This type of integration has had added benefits that we didn't even expect. It's helped us with recruitment. When physicians come looking for a practice, they like this kind of care. It's supported the primary care offices so that they can have longer visits and still get the right amount of reimbursement, providing the kind of care they want. It's helped reduce malpractice insurance costs because it improves best practice with the decision support and closing the gaps in care. So we actually had some benefits that we didn't even expect. With the right kind of support and some planned integration, every office, every practitioner can learn to do global capitation, can learn to do population management, and then these changes in healthcare are not scary, they're actually exciting. There are many changes happening regionally and nationally. Healthcare has to change. The old system isn't serving the needs of the providers or the patients. And those changes are going to make it more important to have this type of integration. It allows us to cover the costs and support the needs of the PCPs, and it's going to help the community, the country as a whole, and we'll all be better for it.